First, thanks to the organizers for inviting me to participate in this forum. I've really enjoyed it so far. It's been very valuable. What I wanted to do today was to go back and talk about a piece of research that I did quite a while ago, this publication back in 2003. It's kind of interesting to go back and read a paper that you wrote long ago. It's like looking at photos in a family album. You either go back and say, wow, that was fantastic. I was amazed I came up with these ideas. Or you go back and you're really embarrassed by it. So it's sort of a mix of the two, I think. The most important thing, I think, about going back and looking at this earlier study was that I realized that this was supposed to be the initial step in a longer-term research program using a particularly valuable data set, the Christchurch Health and Development Study. I really need to go back and extend some of the work, and obviously in going back over it, and you'll see some of this discussion in today's session. There were certain things that I intended to do that would have broadened the analysis and made it much more informative. So I think this was really just supposed to be the first step in a wider research program. What I'm not going to do today is talk about welfare reform. This is a very basic issue about looking at intergenerational welfare dependence or participation in the welfare system. And it's part of a longer-term issue in both economics and other disciplines in looking at the sort of this intergenerational transmission of economic advantage and disadvantage. It's been around for a long time. There's a very good survey in the Journal of Labor Economics by Gary Becker and his co-author in 1986, if you're interested. And traditionally what people would do would be look at earnings or occupational status of fathers and then relate it to similar outcomes for their sons. And to look at whether or not basically there was some evidence here of mobility between generations, that young people, for example, could escape poverty that they grew up in. And early studies found relatively low correlations for parents and children, suggesting substantial mobility. So that was the interpretation given to it. So you have very low correlations. If you're born into a poor household, the good news is that it's going to be relatively easy to escape that poverty as a child. However, more recent studies in the last 10, 20 years have focused on the fact that a lot of the earlier analysis had very limited data on the earnings, occupational status, or welfare history of parents and their children. And the problem is basically a statistical issue, is that if you have difficulty pinpointing the permanent or long-term status of the parent, you tend to get a downward bias or underestimate the extent of correlation. So the more recent...
Can I interrupt?
Sure.
And that was also all about men.
Yeah, it definitely was all about men originally. So it was about fathers and their sons. Yeah, yeah. So you'll see in this case I actually have information on both parents and both sons and daughters. So one way in which it's been broadened. But later studies, and you can see the articles by Sol and Zimmerman. By the way, I have copies of the paper. I don't know if we want to put it on the website, if people want access to it. Okay, or either that we put links on so that people get access to it if they want. But more recent studies have showed much higher correlations. And so the interpretation there, of course, is that there's less mobility than we first suspected, and it's a lot more difficult to escape low economic status, economic disadvantage of your parents. So the study that we did back in 2003 with my co-authors, Shola Imani and Gail Pacheco, was to look at the sort of intergenerational transmission of welfare participation between parents and the children. This is not something that has been done, not only just within New Zealand, but in other countries as well. If you go back and look at the literature, people often talk about welfare dependence and welfare links across generations, but there's very little hard evidence on the extent to which there really is this intergenerational correlation. Partly it's because the data just doesn't exist. It's very difficult to get very good information on welfare histories of parents and their children, and of course very difficult to go to the third or fourth generations as well. So partly because of data issues, it's been very difficult to do that. Part of the reason why it's interesting to look at this in a New Zealand context is that it's really been motivated by what's really a relatively stable welfare structure in this country, at least over the period that we're looking, which really spans the late 1970s through the late 1990s. The basic structure of the unemployment benefit, domestic purposes benefit, sickness, and invalids benefit systems haven't really changed all that much. They have that sort of negative income tax structure. There have been changes in basic benefits and certain changes in eligibility criteria, but the basic structure has been relatively unaffected by policy changes over this period. And that's not the way it would look in other countries. So if you're trying to do the same sort of analysis in the US, part of the problems would be that some of these welfare programs either changed dramatically over this period or disappeared entirely. And a good example would be the AFDC program in the US, equivalent of our domestic purposes benefit, which was basically abolished and replaced by quite different programs during this period. What we use is some very good information on the benefit histories of parents and their children from the Christchurch Health and Development Study. We have indicators of welfare participation for parents over the ages of 1 through 14 for these children. And as you'll see, we basically have snapshots at 14 different periods of time. So these parents were re-interviewed every year during this period, and we basically know something about whether or not they were drawing a social welfare benefit during that period of time. We don't have information between those interviews. That question was just simply not asked of parents during this period. Then we have lots of data on the benefit histories of the children that were the subject of the study. These were the children born in the Canterbury region in 1977. And we know something about whether or not they were drawing a benefit between the ages of 16 and 21. Okay, not only whether they were drawing a benefit at the time of the interview, but whether they were drawing a benefit at some point between interviews. Okay, we cobble that together to come up with some indication of the proportion of time that these youth had received some sort of income-tested benefit over this period. It's a relatively small sample. If you know anything about the Christchurch study, it's about 1,200 children born during a 4-month period in 1977. And for lots of reasons, the sample size gets reduced. We're following everybody up through the age of 21. So for our purposes, the sample is roughly 850 children and their parents. And again, cobbling together all this information on the benefit experience for these youth between ages 16 and 21, they are on the benefit about 10% of the time on average between those ages. And much higher proportions on the benefit for females relative to males. The stars indicate that there are statistically significant differences, and much higher participation for Maori youth, and of course those without a formal school or tertiary qualification, much higher proportions. Not surprisingly, there's a huge amount of dispersion or heterogeneity among the sample. More than half of these young people never received any form of social welfare benefit by age 21.